Hello, hello. Welcome to Hygiene Elevated Conversations and Innovations. Today we are super excited because we have the one and only Tina Clarke, aka Teacher Tina, with us, and we're going to be discussing all things anesthesia. So, Tina, we are very excited to have you with us talking about all things anesthesia.
I'm so excited to be here with you guys. Seriously, this is fun, and I'm glad that we were able to make this happen with
Yes.
with all the things. Yeah, this is cool. I love what you guys are doing here.
Thank you, Tina. Well, I'm going to give you the floor, but I want to ask you, can you share a bit about your journey from becoming a dental hygienist to becoming an anesthesia educator and regional expert, national expert?
Oh gosh, so that is quite a long story, but I'll try to keep you to the mini version so we get to like some of the really good stuff, right? But
Let's hear it, Tina.
yeah. So like really honestly, my journey of becoming a hygienist was because of my hygienist. I
Aw.
went into her office and was this kind of like lost soul trying to figure out what I wanted to do. And I was like, I think I see that there's jobs in the dental industry. Tell me about this. And so she really encouraged me to pursue the profession. And once I started working for a while, I got my bachelor's degree in hygiene in 2001 and had been working for a while and got a little itchy, like you're like, there's just
Need
something
more.
more. There's something more. And I started asking around, like, oh, tell me, what is it like to be a sales rep? What is it like to do this thing or that thing? And I had, made lots of connections through the industry. And the same hygienist told me, she's like, hey, I hear that there's this new program that's starting up where they're looking for this dental hygiene program in the state of Oregon was expanding out to distance education, starting up some distance ed sites, and they're looking for people. Maybe you should look at that. Like, well, I've never taught before, but I'm curious and I'll at least go through the interview process. So I met with the program director and decided I'm going to go ahead and apply. And they interviewed me. And on my drive home, they offered me the job. And I was like, oh my gosh, are you serious? Because you do realize I don't know what I'm doing. And you're asking me to teach these people? Like, okay, are you sure? Are you sure you want me? So thankfully, they saw something in me that I hadn't discovered in myself yet. And that was a wonderful opportunity. And it was really that opportunity. It was just me and 5 hygiene students. I was in charge of teaching all of the hands-on stuff like radiology, dental materials, instrumentation, and local anesthesia. So they had all of their lecture stuff online, but I was in charge of all the hands-on. And really, when it came time to start teaching the anesthesia lab, and the students kind of had this, oh my gosh, I don't know what I'm doing, and kind of the scared kind of thing. And in my mind, I'm like, I don't know what I'm doing either. I don't know how to teach how to give injections. Like, I went into this not knowing how to teach. And now here it is. I'm teaching how to do injections to people who are freaked out of their brains about giving injections. So, talk about like swimming with sharks, right? I mean, it was just really intense. So I was like, well, I'm going to embrace it and we're going to figure it out and we're going to figure it out together. And I recognized and honored that they were afraid. And I said, hey, you're normal. You're normal. Giving it is scary. It is totally, it's scary to get them. It's scary to give them, especially when you're first learning, but we're going to work through it. And I promise you, once you get it, you're going to be like, this is the best thing ever. And I think that was kind of the drive behind me becoming the anesthesia person that I am, because those students went out and shared their experiences. And then I had other people asking, oh, Tina, what are your tips for this? Or what are your tips for that? And then when I changed to a different educational institution where I had multiple faculty members with me at the same time, it was, you start talking, you share with your colleagues what works for you. And I just kind of started to become the go-to person for that particular topic, especially. And yeah, that's how anesthesia began. And actually that's how the name Teacher Tina began as well. I'll say this and then we can move on. But one of my coworkers, one of my fellow faculty members, before we worked together, her daughter was one of my hygiene students, and she said on a regular basis they would be talking. She's like, "Well, what does your Teacher Tina say? What does Teacher Tina say?" And then when she started coming and we started working together, and other students would be asking her questions like, oh, let's go talk with teacher Tina and find out what she has to say. And so to this day, and she lovingly, I call her Mama E. Her name is Elisa Schofield. And so lovingly, I'm like, and Mama E, she gets credit for coming up with the name of teacher Tina. So
I love that.
It all kind of comes together like that.
My takeaway just from that whole story, Tina, and I got to meet you once, we got to have dinner. You have the best attitude of any situation you're in, of just embracing and rolling with the punches and just looking for the good. And I think that is so much of what put you in the position that you're in. Obviously, you're a wonderful person, but your attitude towards those challenges, that's fantastic, because so many people maybe wouldn't have done the same thing.
Oh, thank you. Thank you for saying that. That warms my heart.
100% true. That's why. So no, I love that. That's a life skill. Like, that is absolutely a life skill.
Well, thank you. Well, you do. I mean, life is going to happen. Life is going to get lifey. And you can either say, peace out, go away, I'm going to curl up and hide. Or you can say, well, here we go. We're going to roll and we're going to learn. So,
yep. No, that's so true. And if you can learn that early on, the less trauma you're going to have.
Yes. Yes. So for all your listeners, learn it, embrace it.
100%.
And I love, Tina, that somebody else gave you the name Teacher Tina, because like if we were going to go with a name like that someone gave me, it would be the Joffrey Show. That's what
we've decided, that it is the Joffrey Show.
Amanda coined me the Joffrey Show. So I don't think I can market that quite as well as you can, Teacher Tina.
Well, it sounds very CNN, MSN kind of, maybe, or it's like, the Oprah show. It's kind of that kind of vibe to it, right? I think I think, it maybe turn into that.
I love it. Okay, Tina, can you share a memorable experience from your career as a dental hygiene educator that highlights the importance of proper training when it comes to injections and anesthesia?
Ooh, gosh. Let's see. Can I think of a highlighting moment? Well, I can say that I've got 2 moments where it was like, maybe 3 or, okay, well, one is I have a former student when I was teaching her in anesthesia. We were learning a particular injection called the Vazirani echinosis, which is a closed mouth mandibular block injection technique. And we had just learned it, like, I think a couple of days before her brother came in to receive treatment. And her brother has special needs, is a moderate functioning individual with autism, severe perio. And so he was in, and she chose to do the VA injection for him. And it's like, I think about it now, I get emotional about it, because it was the first time, that he was able to receive comprehensive dental care, because even when he would come in and we weren't trying to do any injections or anything like that, and it was still his sister, he just got like, oh. But there was something about us going through that learning lab and her being able to have a conversation with her brother and then being able to perform this injection technique, that it was like, okay, it really does make a difference when you have somebody who truly cares and is applying that information in a clinical setting. So that would be one that was pretty phenomenal and heartwarming. That would be one. Another one was kind of funny, where I had a group of hygiene students that were anesthetizing for a community health event. They were doing all of the anesthesia for the oral surgeons. It was like a mission of mercy kind of a situation, and we were hosting it at the school. And the hygiene students, as one of their kind of rotations, that's what they did. They numbed everybody up for extractions. So they were having this opportunity to practice their skill sets and really excel at them. And what was really funny is, the individuals in line started talking with each other, because there was hygiene students and a couple of oral surgeons that were doing it. And they start saying, hey, make sure you get into the chairs with the younger girls because they give injections way better than those old dudes do.
It's true. Most of the
And so
time.
that was a pretty funny moment as well.
You want her.
Yeah. Go there. See if you can get into the chair with one of those people. They do know what they're doing, and they're a lot nicer.
So, Tina, you have taught many a anesthesia class, and as a student, you remember there was always like folklore going around or like gossip of like this is what it's going to be like, maybe from your upperclassmen to your lowerclassmen. But what are the challenges and misconceptions that students have when it comes to learning injections? And just doing anesthesia in hygiene school.
Oh gosh. Well, you guys, I not only do I teach this to hygiene students, but I also teach anesthesia to already licensed individuals who maybe didn't have anesthesia certification already. So
Mhm.
I help them go through that. So I would say it's kind of a common mindset for anybody. Doesn't matter if they're a hygiene student or an already practicing clinician and learning the skill for the first time. There is this underlying fear of inducing pain, like that you're going to cause more pain and more harm to your patient because of, oh, it's going to hurt. You're going to poke them and it's going to hurt. And really it is a mind shift change where it was like, yeah, it could, it doesn't have to hurt, right? It doesn't necessarily always have to hurt or be uncomfortable when we're giving injections. There's things that we can do to reduce that. Maybe it won't completely go away, but there are things that we can do to reduce that. But the benefit completely outweighs any of the perceived negativities of giving an injection.
Yeah.
A little bit of a poke for 30 seconds versus an hour or 90 minutes of having your wounds debrided, right? And so it's
Yeah.
having that kind of conversation. So that would say that's the number one misconception, is that they're going to be causing more harm or more pain, more psychological pain than actually the process would require.
Yeah. How do you kind of address issues with students, not issues with students, but students are having challenges, maybe just mentally or physically? How do you address those?
Yeah. So I will say with physical challenges, I've had students in the past that just couldn't stop shaking. Just couldn't stop shaking, literally. I had one student, it was a neurological condition. And so it was like literally, like, you need to go to your primary care provider and have a conversation and find out what's going on with you physically, neurologically, to see if you can even do this profession, right?
Yeah.
Because it was even with like instrumentation and everything. And so, for him, coming into dental hygiene school actually helped him identify an issue to go through and get medication to help with that, to understand what the cause was. But usually it is the shakes. So we talk about stabilization techniques, ways that you can position your own personal body, like standing when you're giving an injection, because you can get nice and close to your patient. You get to have your elbows really tight to your sides, or doing alternative positioning so that you can have proper stabilization to be able to administer your injection. So that's usually like physically some of the biggest issues. Psychologically, I can speak. Mentally, psychologically, a lot of it is just having a conversation with the clinician, the student that's going to be doing it. I've had students in the past who are like, if I even see a needle, I'm going to pass out. And so I'm like, okay, well, let's start off small. We're going to start off, and we're just going to quote unquote play with the needle. Let's hold this syringe. Let's put it together. We're going to stab some fruit. We're going to stab some meat, and just get through that whole process of just feeling comfortable with the weight of the syringe in the hand, and then moving forward from that. And then it's like, once they've done it a couple of times, it makes it a lot easier. Or if they're on the receiving end, knowing that that person that is practicing on them is being monitored like a hawk, that really helps too.
It's very true. Very
Yeah.
true.
Yeah. Right. They're like over, yeah, we're like over you standing there. Your instructors are getting like yoga ab work poses because we stand on one leg and lean over and try to do all these things without landing on a patient at all. It's like it's crazy.
I love that, Tina, because it just takes me back to being in anesthesia class myself. And I remember practicing on each other and
Mhm.
having those like shaky moments. Like, I've never done this before. What is like I am
Yeah.
now in charge of this syringe and this needle going into your mouth and your body. And um I have to say, like, I would have loved to been in one of your anesthesia classes. My anesthesia instructor was incredible. Dr. Allen, he ran the clinic that was attached to the school, and he just made it so simple and fun. Like, it's just
Yeah.
simple and fun. And so when you and I were at dinner and you were like talking about the controversy of calling anesthesia class stab lab, I'm like,
Yes.
oh my god, I wish I could have called it that. Like,
Yeah,
why
we did
were
not.
we had no clever nothing. I'm like, "Oh, we missed out on that experience of calling it Stab Lab," and I'm like, "Oh, I wish I could have." Uh,
Because you do, and there is a huge controversy around it amongst educators, and I even say, okay, we're syringe slingers, right? We're fellow syringe slingers going in,
mhm.
doing our thing, and um, and it's like it's not being disrespectful. I don't say it as in a way of being disrespectful of the seriousness of what it is. It's like, yeah, we do have to take it serious. There are infection control issues. There's sharp incidents, accidents that we have to be aware of. There's medications that we are doing. But I think oftentimes we fall in this trap of taking ourselves way too seriously.
Mhm.
And when we do that, that puts undue pressure on the teacher and the learner to be like, it's okay to not be perfect with it. And you have to have fun. If you're not having fun, you're not learning. Really, truly, if you're not having fun, you're not learning. So,
Well,
yeah, it's Stab Lab and you're a syringe slinger.
yeah, but if it's fun, you're learning more. Like, you're
Uh-huh.
engaged and you're in it and you're,
Yeah.
like, just absorbing all of it because 'cause you're having a good time. Like,
Yeah.
and so I love I'm like, where was that when I was in school? Why were we not calling it that? We should
Right,
have been.
right. And I have to say, like, there's a time and a place for it, right? Like when you were just a group of students and you're talking or in lecture and you're talking about it, it's a perfect time to joke around and stuff. Like, but when the actual injection is happening, that's when it's time. Okay, this is real now. We're being serious. And
Oh,
then when it's all done,
100%.
we can say, so there's always a time and a place. But yeah, it is. It's gotta have fun.
I brought that up in front of a patient the other day. I forget how, but I was speaking loudly so that my doctor would hear it. He's a brand new grad. And I was like, I wish I could have called it Stab Lab, ha ha ha. And she thought it was the funniest thing she'd ever heard. And, everybody was chiming in the moment, but it created a funny moment in what is typically a tense, can be a tense moment. And it's not for everybody. You have to know your patient. If you're saying it
Right.
to a patient,
Mhm.
the last thing they want to hear is stab. But this patient she's sadistic. So she totally enjoyed the moment and laughed vigorously about it.
Yeah. Well, and the same thing, like you said, with your patients, you have to know your audience. But when somebody's like, "Oh, I hate getting needles. I hate getting injections," it's like, "Oh, good, you're normal."
Yeah,
Because I don't want somebody that's in my chair that says, "I love it when somebody gets my face numb. Can you do that more?" I'm like, "Are you crazy?
weirdo.
What,
No one's ever said
what
that to
kind of
me.
cocoa puffs are you eating? Because that is not. You're a cuckoo." I'm like, I love doing injections, but I'm saying, like, if I have somebody who's like, "Oh, please, please, please," I'm like, "Yeah, I don't
Yeah.
know. I don't
I've
know."
never experienced somebody saying, "Please, I love this so much." Like, I had somebody say they
Oh,
didn't mind it because he has to give himself a shot every week. That's fine. But yeah,
right.
not a please. Nobody's ever, "Please give me a shot."
I have on my social medias, I've had people DM me going, where can I go so that students can practice on me? Because I love it. I love the feeling. I love the feeling. I want to feel that. And I'm like, okay, ignore. Like legitimate.
Ew.
I've had, yes, it is. There are people. There are people.
The internet brings out all those people.
Yes, it
I,
does.
I don't think I went to the dentist regularly as a kid. Like, to my
Mm-mm.
knowledge, I'd have to ask my parents to confirm this, but I don't think we went regularly. But when we did go, I felt like they always did a same day flip on us. So now I know the term, right? Same day treatment. They would
Uh-huh.
always schedule enough time to do fillings on my sister and I. And I absolutely hated being numb as a kid. I hated it so much. Like, expect not the being numb, it was more of the like the numbness going away.
Yes.
Yes. Isn't
That's
that,
the part I hated. I'm like, ah, I hated it so much. I would try to take a nap. I'm like, if I
Yes.
sleep this off, it will be so much better for myself. And like 10-year-old Joffrey is like trying to fall asleep so the numbness goes
I
away.
find that being a hard visual.
I
I'm
always
picturing like on a
oh.
trampoline going, maybe if I just lay down on the trampoline, I'll take a nap.
Maybe I'll just fall asleep.
Oh. I always try to schedule a nap after any dental work I need because I hate that feeling when it comes back. That's my least favorite part of
Right. Do you
anesthesia.
find like you're itching? Like you start want to
Yes.
itching your face and you're like, am I gonna itch my skin right off of my face?
Oh.
Yeah. It's
Yep.
such a
But
weird sensation.
the reversals. I love the reversals. Wow.
Yeah.
I've never used them.
I loved them. And I used them on my kids too after their dental treatment. I was like, I got a
Really?
treat for you. Yeah, absolutely. And I feel like there's this disconnect almost where we're not offering that to patients enough. Like, hey, if you
It's
don't want
not,
to be numb,
there's not a lot of knowledge about that um reversal agent out there. The Auraverse, I think Auraverse is the only company out right now that has it. A funny little story is the medication for that. I have to look at it. The mesolithate, it's something like that. I don't have it in front of me. Sorry, but it's the same medication that they use for erectile dysfunction
What? Oh, because
because it causes
the
vasodilation.
vasodilation. Yeah.
So,
this is so funny.
so when you reverse that patient, their tissue might get a little plump too. So just be there.
That-
I love
Just,
it.
interesting.
just saying.
That is very.
I know we're trying to keep it clean. Keep it clean.
No,
it
this
clean.
is
It's
great.
just so interesting. No, that's a fascinating. I wouldn't have thought, but that makes perfect sense.
Right? You'd be like, why is my tongue feel 10 times too big when I'm trying to get a numb? Well, I don't know.
Extra blood
Maybe
flow.
extra blood flow.
Oh gosh. Okay, well, we're slightly off subject, of course, but I'm curious now, not about the same thing, but what do you think about the buffering agents? I
Oh,
used to work at a
yes.
dental office that we buffered and we loved it, but not many offices buffer.
Isn't that so sad? Medicine, the just general medicine field has been buffering their anesthetics for decades, and
Mhm.
dentistry's finally starting to catch up. I think one of the reasons why dentistry's finally starting to catch up is because we finally have some modalities on there that make it easier for local anesthesia in the dental world with our specific style of syringes that we use. But yeah, I think that's going to be a trend we're going to be seeing a lot more in the dental world, is seeing buffered anesthetics being used on a regular basis, simply because of one, it's a time saver. The time for anesthesia just skyrockets, so you can basically get your patient, numb, cap the needle, maybe do a couple of chart notes, get some things set up, and they're ready to go within like 2 to 3 minutes versus 5, 10, 15 minutes. So that makes it nice. And our patients, they really like it a lot more. Didn't you say, like, when you agree, like when you
So much
used
more
it,
comfortable.
they were like, oh, I barely felt anything. Yeah.
Mhm.
Yeah. It was really
Yes.
nice. Super nice.
Interesting. Hmm.
Yeah. And I think there's like I know like one company's Onset, and there was another company called Anutra. I don't know if I heard a rumor that they didn't survive the pandemic, but I thought I saw something recently that they had been doing something. So I don't know. But I know there's a couple of companies out there that actually make it for people. Yeah.
Interesting. Yeah, it was nice. It was like that long green thing. You
Yeah.
loaded your syringe at your carpule at the end, and then you dialed it and
Yeah.
however much you wanted it. And
Yeah. Like 30 seconds flat and you're done, ready to go. Right. Yeah.
yep,
Yeah.
it was fast.
Yeah. And you liked it for your hygiene patients too, huh?
I did. We used it more. I worked at a cosmetic office at the time, so we didn't have
Mm-hmm.
a whole lot of hygiene.
Perio. Mm-hmm.
Yeah. Um, but yeah, we did all the anesthesia in that office. It was rare that the doctor did any, so yeah.
Cool.
Amanda,
Yay. I love it.
speaking of cosmetic, you were telling me about like a
Uh-oh.
newer injection.
Oh, right. Okay, I don't remember the name of this one, Tina, but it's a palatal injection, but it gets the whole anterior. Tell us about it.
So the whole anterior?
Correct.
Because there is the AMSA, which will get premolars to the midline, and that's a palatal injection, but it doesn't
Yes.
impact the upper lip.
Right. Right.
Yeah.
The AMSA.
Yeah.
Yes.
Yeah. So there's that. And then like if you do follow that like with the NP, like the nasopalatine, oftentimes because the bone is so porous through there, and especially if you use articaine, you can probably get some pulpal anesthesia with that as well. So
Mhm.
which then would get you pulpal anesthesia to the other opposite canine. But I think you might be thinking of the AMSA, the anterior middle superior alveolar one. Yeah.
Yes. Yes. So yeah, that one that at that office, I never started to do it. Um, I had just moved up here to Utah, and so they had started implementing it into practice, and I was like, I haven't done this yet, guys. So this seems like a whole different area to poke on the roof of the mouth. So I wasn't
So
there.
so did they use it? Did they do a traditional syringe with it, or did they have an automated delivery device?
No, it was traditional.
Traditional syringes, yeah, yeah,
Yeah.
yeah. I have a lot of people that ask me about that when they're like, "But don't I have to use an automated delivery device?" And I'm like, "No, you don't. I mean, it makes it
Mhm.
easier, and for sure, it makes it easier if you have a computer aided delivery device for any injection, honestly. But yeah, no, you can do your palatals with a regular one, especially with that AMSA. It's so
Yeah.
nice. Yeah,
Yeah, I know the reason that he started to like to use that specific anesthetic was or not anesthetic, but technique. It was a cosmetic office, and he was a member of the American Academy of Cosmetic Dentistry, and we needed those instant photos, and you couldn't have a droopy,
yeah. You can't have like a
goofy smile. Yeah, so that was standard from then on. So he loved it. He absolutely loved it
Yeah,
for that.
and I think that injection is relatively new, like the kind of
Yeah.
the relatively new kid on the block. It's really only been around since like I would say early 2000s, early mid 2000s, and
Wow.
I think it was a cosmetic dentist that was like, "Hey, there's this thing where you
Mhm.
should do this." And yeah, it is used quite a bit for cosmetic dentistry.
Yeah, one of these days I'll be brave and I'll do it when I work on my anterior.
Oh, you should. I
I
empower
know.
you. Do it, Amanda. Come on. You can
I'll
do it. Like you can
You
do it.
gotta
It's
do it,
super
yeah.
easy. Super
Um,
I
easy.
feel
It's
peer
very forgiving.
pressured.
no, don't feel pressured, but you should do it. I'll pressure you actually. I'll pressure you.
Thank you.
Yes. Speaking of
Okay.
pressure, do pressure. Do pressure anesthesia when
Yes.
you do it. Okay,
Oh,
do
I
pressure
always do pressure anesthesia, the proper pressure anesthesia on palatals. I think
good,
it's
good,
the
good.
smartest thing.
Okay, Tina, so you're do like refresher courses for
Yes.
hygienists,
Uh-huh.
and obviously there's a need for it because I didn't even know about this injection Amanda was just telling us about. Like this was news to me. How frequently should hygienists be doing like a refresher course? I mean, we have so many options for our CEs. We need them. But like in your take, like how frequently should we be brushing up on our anesthesia?
Honestly, I think it's just like with anything else that we do, like we need to have regular updates. I would say honestly, with local anesthesia, if you do it on a regular basis, you could probably go like every 2 to 3 years, get yourself an anesthesia, even if it's just a lecture review course, right? Some sort of CE course. Now, I would say like, if you're like, oh, like it's been 3 years since I've practiced or 2 years since I've practiced, or I might do an injection like once a month, taking a moment and saying, okay, let me do some hands-on review again, just to remind yourself what you learned at one point in time, kind of dust off those cobwebs, I think would be a very huge benefit to our patients. Because we have to remember, like, we have standard of care. We have to be ethical in our process, and knowing that we can give an injection in the right spot is always a really good thing. And make sure we're selecting the right anesthetic for our patient is always a good thing. Yeah. So I would say, at least every 2 to 3 years, do some sort of continuing education around anesthetics. And I think that there are some states that do require that. Like, I think like New Jersey or New York has you have to take a local anesthesia course every 4 years or something.
Wow. Well, I will shamefully admit I'm overdue. I think Dr. Malamed taught the last one that I was in. So
that's okay.
Sounds like I'm due to see some teacher Tina.
Come see me. Come see me. Absolutely. And I'm going to shamelessly plug here. I'm really bad at my own personal marketing. So I'm trying to strengthen that muscle.
Let's hear it.
Plug away. But I do have online on-demand anesthesia courses that you can take. So if you wanted to just do a lecture review and hear some stuff and like go through it, you can do that. And then of course I have hands-on courses that I have them in Oregon and in Georgia, going back and forth between those two places, providing those. I'm trying to get into more states.
Yeah, that's what I was going to ask. You're in Oregon, Oregon and Georgia.
Yeah.
And
so like opposite.
How did you get into Georgia?
The country?
I know you live in Oregon.
So the way that the Georgia worked out, so I am a certified continuing education provider through the American Academy of Dental Hygiene. So there's that. And then I also submitted my curriculum to Oregon Board of Dentistry with the help of my anesthesia mentor, who was my anesthesia instructor when I was in hygiene school. Her name is Jill Mason, and she's a published author, and she has her own public health textbooks that are out there. And she helped me get this through Oregon. And then, Georgia their Board of Dentistry finished this summer all of their rules and regulations for dental hygienists to do local anesthesia, because Georgia wasn't allowed. I just weren't allowed to do it. And so when that happened, it's kind of one of those moments where who really helps things out. Is I had a couple of hygienists that said, hey, Tina, you need to connect up with Misty. Misty lives in Georgia, and she's really involved in Georgia, and they just got their anesthesia stuff done. And then Misty had more people saying, hey, Misty, you need to connect up with Tina. She does anesthesia, and I bet you guys can probably work something out together. So her and I had a 10-minute conversation at the American Dental Hygiene Association meeting this summer in Chicago. And I was like, okay, let's do this. We're in. And I went through and I looked at what Georgia required for their certification courses. I wrote it all up and submitted my curriculum to them. And the Georgia board approved all of my curriculum. And so with Misty being in Georgia, she's kind of my boots on the ground and helping me get all of that stuff out through there. So as for certification courses, that's where that's at. So that's how that happened. Yeah.
I love that you were able to accomplish all of that, Tina, because in Utah for us, it feels like impossible to be able to give out CEs. Like I've tried so many times, and I just keep running into dead ends. So eventually I'm going to get there, but it is not an easy process. So I think the fact that you can it's inspiring. I am inspired that you guys have, it's like, if they can do it, I'm sure I can find a way. So
you can do it. There is a way.
This, Tina. Thank you.
Absolutely. And I want to come to Utah and do a hands-on class in Utah too. Like, even if it's a refresher, not a certification course, but a refresher. That's my ultimate goal. Is I want to be able to be in every single state doing some sort of refresher, just helping people, or having people come to me, or go to like Jamaica or something like that and do a.
You know what?
We're there.
I can bring you to Utah, but not Jamaica. But the DSO that I'm with, we do continuing education courses company-wide every quarter. So I would totally
Let's make
send the
it.
invitation to you and get you on
Let's
for
do it.
a CE course for us because it would be so fun. Oh, I want to shift gears here, and I apologize. That was my doorbell. My husband sets it up for the kids at like every holiday. It changes. Like so for Halloween, it was like a
What?
witch cackling.
I
And
love it.
now you guys just heard like
No.
a jingle bell thing. So I'm
Yeah.
like, come on, you guys know we're recording, but they don't care. So,
You know,
I apologize.
you know it's real and not AI when that
Yeah.
happens.
Uh-huh.
Yeah.
My dogs are usually barking. That's our thing. That's my thing.
Okay, but no, I do want to shift gears, Tina, and I want to talk about protocols for when a hygienist accidentally pokes themselves with a needle.
Yes. Yes.
Yeah. Well, one, let's not do that, right? Let's practice
Right.
safe uncapping and recapping, but pokes
Yes.
happen. Pokes really do happen. So anytime, and this is just for anything, it doesn't matter if it's with a needle, if it's with an instrument, if it does happen, what you need to do is, take your gloves off and wash your hands really well with soap and water. I think a lot of people think, oh, I want to squish the blood out. Don't, we call that milking the wound, right? You don't milk the wound. Just wash your hands really, really well with soapy water. And then the next step is to have a conversation with your patient. Again, it doesn't matter if it's a needle, it doesn't matter if it's an instrument. You have that open wound cross contamination that you have to have that conversation, and hopefully your patient is open and willing to also go and get tested because they may have something that they don't even know about. And you don't want to deal with that. You don't want to have that worry resting on your spirit. And unfortunately, I've had to witness that process more times than I want to, that I ever wish I would have. So it is scary when it happens, but that's what you want to do. You want to clean it, have a conversation with your patient, and everybody goes and gets a blood draw and does some follow-up blood work just to assure that there aren't any bloodborne pathogens that entered you. Yeah.
Okay, thank you for saying that because
Mhm.
I was one of those poor souls that accidentally poked myself. And when I went to go get testing done, the medical provider that I had at that time was like acting like I was being over the top dramatic.
Mm,
And we're like, you're fine. This was just this tiny sub prick. Like, you're going to be just fine. And like, felt like the testing I was requesting was like completely not applicable. And I'm like, well, from what I know, this is what I need to do. And so
right.
you just fulfill these tests. And I was kind of like, have I been misguided my whole career? Like, why are we not on the same page right now?
Well, I will say this. I don't, yes and no. Like, it doesn't hurt anything to run all those tests. With that being said, there are no documented cases in which a bloodborne pathogen was spread from one individual to another through a needle stick in dentistry. Like, it would have to have a significant amount because we are constantly not trying to be in a blood vessel, right? We're doing aspirations, those types of situations. It is very, very different. So like if you've given an injection, it was a negative aspiration and you're withdrawing or you're capping your needle and you decide to go boop, not decide, but it goes boop.
Mhm.
That can happen. It can totally happen. The amount of blood that's in there, even if it were to be a positive aspiration, like the amount of blood in there is pretty minimal, but I would say it's a peace of mind kind of a situation. Like, you want to know, okay, good. I really am. All my bases are covered. Yeah. So I would say I don't think that you were out of line or anything for requesting
Yeah,
the
and I
testing that
mean,
you had.
it was just like nobody pokes themselves on purpose,
No,
obviously. But I
no.
was going just from PSA to MSA, and I just happened to just be a little too loose, and just I hit my pointer finger instead of their
Yeah.
gingiva, their gum, and I was like, "Oh, dang it!"
And
And
I think Joffrey, I think your story is really important for everybody to realize is that those needles are sharp. So you do have to pay attention, like where it's going. Yeah.
Yeah, it was just I mean, nobody plans on it, obviously, but it was just sort of a, "Oh, crap," moment, like, "Dang it."
Yeah.
Because I just did PSA, and now I just poked my finger, like, this is
Aw.
literally this needle was just in you, and now it's in me, and I'm like,
Yeah.
"Oh, crap."
And this is not a consensual poke here, friends.
Non-consensual poke.
Yeah.
No. So, on the topic of communication with patients, having
Yes.
those conversations, what are some like tips that you have either for students, existing practitioners that have been in the chair for a while, but what are some tips that you have for helping patients to either deal with anxiety or work through that fear? I had a patient come in. This is the first time in 15 years I've had somebody just with so much anxiety um, of the needle. It probably took him 10 to 12 minutes to psych himself up to let me get in there and do it. I've never seen that so much before.
Mhm.
There's so much more anxiety and stress, I think, these days than previous days. And I mean, I let him kind of work through it. I tried to talk him through it, like talk through the process, like would it help, you to see the needle or not see the needle? What can I do? And he literally just kept telling me, "Can you just punch me and knock me out?" I'm like, "No. No, I cannot. I'm not going to do those things." So, what tips or strategies do you have to help address that?
Well, I think, you kind of started that process already, like having open-ended conversation with your
Mhm.
patients. Oftentimes when my patients say, "Oh, I hate the needle, I don't want it," it's like, tell me more. What is it about the process that you don't, like? What is it about the whole thing that causes your anxiety to go up? Is it just, is it seeing it? Is it feeling it? Is it knowing that it's there? What all is that? And if you can identify, and if your patient can identify kind of the biggest aspect of it, then you can know what modifications you need to make. So if he was like, just knock me out, I don't want to feel it anymore, then it's like, okay, well, we're going to do some, before we get started, let's just do some deep breathing visualization experiences, activities to start getting your mindset away from being right here in the dental office. What kind of music can you listen to help you go into a different,
Happy
mental
place.
space, right? What kinds of things can we do that will help them, like all the different things that we can help with the relaxation. So I would say, that aspect of communication, open-ended questions, so the patients feel heard
Mhm.
and that they feel honored, that makes a huge difference. The other thing is going through, and you can even just kind of do, okay, well, I'm going to do a pretend one. I'm just going to come in like with a cotton swab, just so you can feel what it's like when my hands are in there doing these types of things,
Okay.
just to kind of warm them up a little bit.
Yeah.
Yeah. Oftentimes also it's like our verbiage. Oh, I'm going to give you a shot. Like patients, like they hear that's like white coat syndrome all of a sudden, right? They're like, ah. So it's like we're going to do a little anesthesia so that you can feel comfortable, and you're normal that you don't like this. That is totally okay. But I'm going to make this go as quickly as possible and empower them to know, like, if at any point in time you need me to stop, I want you to, and so if I'm on the right side, I say, I want you to raise your left hand, and I'll tap on their left hand and say, I want you to raise this hand. And if I see that hand come up, I will come out of your mouth and we'll pause.
I think empowering the patient goes so far, like,
It really
having
does.
that empathy, having a conversation, and then giving them that little bit of power really helps because we
Yeah.
all know being in the dental chair is the most, like, vulnerable position you can be in.
Yeah.
So, I think those are phenomenal.
Yeah. And I think a lot of times it's that feeling of not control, right?
Mhm.
That okay, you're have me here and you're sticking something in my, like, if I move, I can't move, I can't do anything.
You
So
can't
it's
communicate. Yeah.
right. And that's why I think for my student that has her brother, when he came in and she did the closed mouth mandibular block technique, why it was so successful is because she had that conversation with him and was able to do an injection that didn't feel so invasive of like, I'm right over you, kind of a thing, you know?
Oh, those are true. It's true. That's very true. I
Yeah.
think it's easy as any profession, I'm sure, but to get into routine, and we're so used to being on the giving side of it, we often forget that receiving side, and that sounds silly, but one of the reasons that I will not clean my own teeth, I want to go have a hygienist clean my teeth, is I want to be on that receiving side and remember what it's like to be in that chair, to feel the polish, the ultrasonic,
Yeah.
whatever.
To be
So,
tilted back and go,
yeah,
oh gosh, this is
exactly.
going back a lot further than I thought.
Yes, it's easy to become detached. So, kind of recentering yourself as a provider, I think it's important. So,
Yeah, I'm gonna echo that, and that is one of the ways that when we can put ourselves in the patient's shoes, we build that trust with them. We
mhm,
really do. Hmm.
yeah.
I want to take it back to the music choice. I had this pregnant woman, she's in her like second trimester, and perio. And I am
Oh.
like, we are going to take care of this for you, right? And we have a plan, no dental insurance. We're talking paying cash. Obviously, I'm able to convey how important it is that we do this cleaning, but due to finances, we have this plan. We're going to do quadrant by quadrant so that she can afford the treatment. We do one of the quads, first appointment. She comes in for the second, and I already know she's got a lot of dental anxiety. So I am like, listen, I have your blanket ready for you. You tell me what you want to listen to. You can have your music. She liked country. I do not, but I listen
You
to
got the
country the
Joffrey
whole time.
show.
Yes, I will. I put all the stops out for her. And by pulling out all those stops for her and like making her feel so important, right? Like,
Mhm.
you are my only focus. When she came in for appointment 2 for what I thought was gonna be just one quad based on our prior appointment, she was like, "Joffrey, can you please just do the whole thing today? Can you finish it up?" I'm like, "Yes. Yes, I can. What do you wanna listen to today?" So we put on her music, gave her the blanket, took care of the other 3 quads, and it was just a very rewarding moment because here we are, like somebody who has no dental insurance. This is very expensive to have done. But it just made me feel like I did such a good job at illustrating why treatment was important, why this needed to be done, as fast as possible, really,
Hmm.
and the benefits that was going to bring her in the and so it was just such a cool moment where she was like, she showed up and was like, let's finish the whole thing. I know I said 4 visits, but let's do it all today. I'm like,
You
okay.
know, and
Aw.
it's because you built that rapport, you built trust with your patient, and anytime we build that interpersonal trust, our patients' anxiety levels go way down, and they start to have faith in you, and they know that what you are doing is for them and their best interest, and that you truly care about them. And I think that that's how we as hygienists win patients for life. You know, like if we I think we all have those patients who are like, all right, Amanda, Joffrey, Tina, like wherever it is that you go, tell me where you're going to be, or I will completely rearrange my schedule to be there when you're there, because I know that I'll be in good hands when I'm with you.
Mm.
And that's how that you have to, like, that's the number one thing. If you want to be able to do all the treatment for your patient and you need to get them anesthesia, that's what you have to do. You have to listen to them. You really
Yeah.
just have to listen.
Okay, Tina, what
Yes.
are your favorite non-injectable anesthetics?
Oh gosh, this is hard because it's really hard for me to answer because I
Okay.
am so focused on what are my patient's needs and what is my patient's health history
Mhm.
that
It's
but
open-ended. It's open-ended.
that's the one that I want. But I will say that um, clinically, I use Cetacane and Gigicane regularly. And then I do have some instances where I'm pulling out the Orachix, the lidocaine prilocaine mixture as well for patients that maybe like have different kinds of health history issues or sensitivities. I'll use that as well. So that it's kind of a mixed bag, and it also depends upon what's the procedure that I'm doing.
Mhm.
Am I doing pre-anesthesia for an injection? Well, I'll probably grab my 20% benzocaine glob. Am I doing a full mouth assessment, debridement, slight debridement, I'll pick something like gingicaine or the Orachix. Am I doing quadrant therapy where they don't have super deep pockets but they have really tender tissue? I'll probably grab my lidocaine.
What, if we're not allowed to talk about this, we can take this out, but how do you feel about the Synapse dental pain eraser?
I think that the Synapse pain eraser has its place in pain management. I definitely do. I find that it works really well for dentinal sensitivity and for muscular sensitivities, muscular pain, like jaw joint pain.
Okay.
That's where my successes have come in with it. I haven't had a lot of great success with the full mouth pain management aspect of it, but it definitely works for dental hypersensitivity. Now, I have seen videos where like people have done the like a restorative procedure while the synapse has been on the tooth. I've seen it, but I have not, I've seen a video, but I've not experienced that in real life. So I can't speak to like how potent it is, but yeah, I think I think everything has its time and its purpose and place.
Yeah, I agree. I have noticed that it feels like some people are very sensitive to its pulse waves.
Mm-hmm.
And some people are totally fine with it.
Yeah.
But
Yeah,
I
when
haven't
I put it on my tongue, like if I can feel like the little vibrations, kind of like when you were a kid and you weren't supposed to put batteries in your mouth,
9-volt battery.
right? Like you can feel that little bit of, or occasionally you can feel that. But again,
Yeah.
like you said, some people don't necessarily.
Yeah.
Mhm.
I haven't used it TMJ wise yet, so I
Oh
want
my
to
gosh,
do. Really?
I did use it for my TMJ because I was like super stressed out, had been clenching, and like I was just kind of locked up a little bit. And I took that wand right up in there, right up into the condyle as much as I could, right up into the medial pterygoid muscle coming all down, and really worked it through there. And all of a sudden I'm like, oh, my jaw pain is gone, and I don't feel like I've got as much of a headache as I did before.
Huh.
Yeah.
Okay.
That's awesome. So, Amanda and I, we went to RDH under one roof together, and they give you these like drink tickets. So Amanda's not a big drinker. She gives
Not a
me all her
drinker.
tickets. So
That's why Joffrey keeps me around for my
yeah,
drink ticket.
Joffrey with a couple cocktails. I was like ready to buy anything on that showroom floor. And one of the things was the Synapse. So I was like, oh, I'm going to get me one of those Synapses. I want one. And the reasoning was not actually for my patients. I bought it for my kids because
She did.
um they're my daughter, she's 10, my son is 7, they're losing teeth, they're growing teeth, they're doing all these things, and I'm
They're
like,
in sports.
when they complain of teeth pain, I don't have anything to help them. So that's why that was my connection to this product. I was like, okay, if my kids are losing a tooth or complaining, I'm going to be like, go get your dental synapse and just rub it on the area.
Yeah.
And I remind them to do that and they love it. And
Good.
I am like, this needs to be in more people's homes. Like more people need to have this because the kids are
Access.
like I'm like, "Hey, rub it on there, like keep going for like a minute or two and then it won't that tooth won't bother you anymore." And they're like, "Okay." And they do that and then they're like, "Oh yeah, yeah." They just like forget all about the pain they were having. I have not I'm going to admit I have not brought it into the clinic setting yet. I
Mm-hmm.
my purchase reasoning was for my home. So I have it at home,
Yeah.
but not at work. I mean, I could
Yeah.
take it to work, I just haven't yet.
I think that it works really well in places where there is maybe like a lot of tooth movement anytime an office is doing like, some sort of ortho, Invisalign, clear aligner type of a situation, because it can help with that kind of pain sensitivity. I know, of course, it was designed by somebody who did that, who was an orthodontist, and that was the reason why it was designed. I will say this: I don't have it clinically because I do have one, and it's still at home. It's at home for when I.
Oh, you're like
I
me.
do that. Yeah, or like I bleached my teeth, and I had some pretty sensitive lower anterior teeth, and I used it, and then I don't know. The thing is, like, I don't remember how much time went by. It's like, but I don't know. I was like, I think like a half hour. I was like, oh yeah, that's why my teeth don't hurt anymore. So
I hadn't thought of that one. And I
Yeah.
have a lower anterior tooth that it lights up when I bleach. So
yeah.
okay. On the subject, but what other trends do you see coming down for anesthesia in the next year or so?
And the next year, so I think that computer aided delivery devices have come a long way. And I think we're going to start seeing some of those come back around and be of use, especially they're getting a smaller, a little easier to maneuver. There's some that are like literally the size of a cartridge that you can, very mobile, just battery operated, that you can use. And then there are some that have a little bit more sophistication behind them, where it almost looks like it's like the size of like a ultrasonic unit or something like that you can move from room to room as well. So I think we might see some of that happening, especially as we are being more conscious of our ergonomics. That style makes it a little bit easier, so we're not like kind of clawing our hand. I think that we're going to see more and more hygienists incorporating anesthesia into their practice as the rest of the nation is coming on board with hygienists being certified with local anesthesia. So I think those are going to be some of the two big things that we see. And buffering. My hope is that we see buffering happening in the dental offices a lot more.
Okay, Tina, hygienists, we're like the head and neck anatomy experts, pretty much. Do you see like Botox being on the realm for us?
Well, several states have it for hygienists already, and several states are working on it. I definitely say, like, hygienists, we have the knowledge, we have the skill set. And, I know it's a controversial topic. Should hygienists do it? Should it not? Because da, 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 da. But here's the thing, is that when you have the knowledge, why not open up another avenue to it within your licensing, within your skill set to do it, especially safely. If nurses who have, a phenomenal training, right? Nurses get phenomenal training, but do they get the detailed training of head and neck anatomy that hygienists get baseline within their education? And then if we go back to take a certification course, it's just more of refreshing our mindset when we're already dealing with this area. I definitely think that's something that hygienists should be able to incorporate into their practice, especially with all the different things that we're learning about the positive health outcomes with it. So yeah, maybe. I know we've got Arizona, right, has it.
Yeah.
And
everyone's got their take on it, but man, I want to be a Botox hygienist to be helping with PMJ, to just help just for cosmetics. Like, I don't even care. I just think I would be stellar at it. I love doing injections.
Yeah, and and I think it's really sad. Nobody thinks less of a nurse who chooses to go down the pathway of providing Botox or providing vitamin B infusions, like making that a career pathway.
No, they're like elevated. They're like the bee's knees. They are.
So it makes me sad when I hear people say, "Oh, you don't want to be one of those." It's like, no, this is another option for the knowledge and skill set. And I don't think that we should look down on somebody for saying, "Hey, I want to be able to use this knowledge for that." We don't do that for hygienists that want to run their own practice. Right?
No, not at all. And there is a component of hygiene that is cosmetic. Like we whiten teeth, it makes people happy. Like let's do
Yeah.
some lip filler, it makes people happy.
Right. And I mean, and you could go down that pathway, right? Very
Mhm.
easily. Like, oh, well, is whitening teeth, is that important for our patient's health? No. When it comes down to it, mental health, maybe, but no. Like,
Mhm.
is somebody going to have horrible disease process if they've got yellow teeth?
No.
No, no. So
But it makes them happy, and
Makes
we
them
love
mhm.
making
happy.
people happy. Like, I would
Yeah,
love to deliver more services to our patients, and I would be so
Yeah.
good at it. Like, I'm like, "This is my" I would be so, so good at it.
right. And it's like, we have hygienists that have, hung up their scalers, but are myofunctional therapists doing
Mhm.
that as well. So I think that I think it yeah,
I
I
hope
think
it's in our future. Oh, I want it so badly.
yeah, it's time for us to catch up a little bit and not start embracing the future instead of trying to hold each other back.
Mhm.
Yeah, I can agree. So, closing questions, Tina.
Okay.
Yes.
Is
Okay,
there
do you wanna go first? Or you want me to go first, Amanda?
You can go first.
Okay. Okay, so Tina, these 2 questions we ask everybody. They're
Okay.
our closing questions. The first one, what do you wish you would have learned in school that took you years to learn and practice?
Oh, stop comparing myself to what the person next door is doing.
Yes.
Stop
I heard
comparing
that.
myself. Yeah. I say that I still have my moments where I'm on the struggle bus with that. But I wish I didn't focus so much on that, especially when I was a student or a new grad going, "Oh, but they're doing this and they're already," and just go, "You know what? I'm on the train and I'm on Tina's cart, and this is where the train cart for Tina is at, and I'm going to honor this moment where I'm at." So I wish I would have
Mm.
embraced that a little bit more.
I felt that. I still struggle, not like envious of, but just like you need that validation almost of like, am I at the right place? Like, am I doing the right thing? It's fine. I mean, sometimes it's good to know if you're doing the right thing, but yeah, no, I felt that. I felt that.
Yeah. Yeah.
Okay, second question. What piece of advice do you wish you could go back and give yourself as a new grad?
Oh, piece of advice, learn negotiation skills.
Oh,
Learn how to negotiate for sure. I wish
okay.
I would.
I want to know the story because there's a story here.
Well, no, I mean, I went in, I was so lucky that my first full-time position, I worked with a great doctor and so embracing and everything. But I was like, oh, okay, that's what you're gonna pay me. Okay, that
Mhm.
sounds good. And that realizing that I had something to give to the office to be able to say, okay, well, sure, yes, I will start. And this was back in 2001, right? I'll start at $32 an hour. Yeah.
Yeah.
Now, after a year, what does that look like? And so instead, ended up being after 3 years, what does that look like? And not understanding that negotiation. And then how much I how much further I would be even now where I'm at as an entrepreneurial professional if I had practiced that skill set younger and professionally younger. So yeah,
Mm,
that would be my advice.
that's solid advice. And I think, yes, something I also very much struggle with to this day.
It's hard. It is so hard.
Mm,
And because oftentimes when you're negotiating, it is this kind of yin and yang and give and take. And I think that as hygienists, especially because we're predominantly a female profession, that there is that little bit of that struggle of, oh, well, I think I'm worth this. And what I'm doing is worth this. And when you read the research, oftentimes the reason why our male counterparts are making more salary or have better benefits is because they asked, they negotiated instead of just accepted. Oh, okay, well, this is what it is.
Yeah.
Tina, that answer is absolutely beautiful. And I'm going to make a little plug here for my student presentations that I do. And I cover so many things with them about like diagnosing perio on existing patients, how to have a high acceptance rate on their fluoride, how to be fast but not too fast as they're taking on their first job. I talk to them about what production looks like on a day, and I need to add negotiation to my list because I'm like,
Yes.
I tell the programs, I will talk about whatever you guys need. You guys want me to talk about building a resume? You want to talk about being successful in an interview? I can talk about any of that. But negotiation, I'm going to put that on my list of things we're talking about in
Yeah.
this presentation because that is solid advice that they need. I love
Yeah.
that, Tina.
Yeah. 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 So can we go to the time machine? Where's the DeLorean? And and make that happen.
Yes.
Yes. Yeah, where was that? I needed that long time ago. Cuz honestly like it kind of feels like um the hygienist cycle is I want to be paid more, and then we ask and then we're told no, and then we go out and look for another job that's paying higher. We get that job, we tell our employers we're leaving because this job's going to pay me more, and then now all of a sudden now they have the money to pay you more, and
Mhm.
you get trapped in like staying because you're in
Yeah.
your comfort zone, right?
Yeah.
When a new opportunity is probably going to be better for you at that point.
Yeah.
Um,
And we could go on for like a whole nother hour,
I
right?
know
On
that's a
just this topic.
whole nother topic.
Right.
That is. But that's where my mind's taking me is I'm like, wow, we need that negotiation power so much.
Absolutely.
Well, Tina, thank you so much for fitting us into your very busy schedule. Where can our listeners find you if they had never heard of you before this podcast? What mediums are you available?
Oh gosh. So of course on Instagram it's teacher Tina RDH, and there's like some underscores in between the teacher, the Tina, and the RDH. And then Facebook is teacher Tina RDH. LinkedIn is Tina Clarke. You can go to my website, teachertinardh.com. I try to make it easy, right? And on my website, there's links to my learning platform where you can sign up for online courses. You can sign up for individual coaching. Like I said, I have people that will, schedule an hour with me virtually to ask any questions. I've done everything from anesthesia coaching to, practice management coaching, or like negotiating coaching. So yeah, that is definitely like, you're like, I've heard it all. So
Tina, you're the absolute best. Thank
Yes.
you so much for carving out
well,
time for us today.
thank you, you guys. You've been fun to talk with. I've enjoyed it. I can't believe our hours like flew by.
Yeah.
It did flow by. And next time you're in Utah, we are definitely hanging out
More
again.
tacos.
More tacos. And when you come to Oregon, let me know so we can
Yes,
go
next time I'm
and
there,
we
I
can
will
do some
stay longer.
hiking, visit some wineries, make Amanda drive, and
I'll be the DD.
I'm gonna need her. Everybody needs an Amanda.
I love it. I love it.
All right, see you later, Tina.
Thanks, guys.
Bye.
Bye bye.